Okay, welcome everybody to the MIPS 2020 webinar. The presentation will begin shortly. Please note all attendees are in listen-only mode. If you have just joined, a recording of this webinar will be sent out to all attendees. Usually that comes out within 24 hours of our presentation. I do see a few more people joining, so we'll give it just a minute longer. Okay, thank you everyone for joining. This is the MIPS 2020 webinar. Let's go ahead and move the presentation along. We hope that a few more people jump on that signed up, but everybody is in listen-only mode, and we will go ahead and move forward. Everyone, a recording will be sent out to all attendees. So if you missed something, don't worry about it. You will get something to look at and see afterwards. All right, we do have a lot of ground and material to cover today. Usually we hold questions for the end of the presentation. If we have time today, we will get to those on the webinar. If not, go ahead and submit your questions. We will definitely send those in a follow-up afterwards. The question box is down at the bottom of your menu on the right. And again, go ahead and submit those during the presentation. If we don't get to answering them, we will send out a follow-up afterwards. All right, okay. Give you a little background on eMedApps. We are a healthcare information technology services company. We provide practices, clinics, and hospitals with a full range of services, as well as a suite of products that were designed to increase efficiency and facilitate communication. The company was founded in 1999. We work as a partner with NextGen since 2001. We worked as a subcontractor for NextGen, and we serve healthcare clients all across the USA. We have services and products for NextGen clients as well. If you have a minute, go out there and follow us on all of the social media platforms. We are on Facebook, Instagram, Twitter, LinkedIn, and then we also have our own YouTube channel with several videos you can watch there. Just look for eMedApps at YouTube. All right, let me give you a little background about our presenter today. Christina has over 20 years experience in the healthcare industry. She applies her clinical, IT, and quality background to aid practices in areas of project management, software implementation, workflow enhancements, upgrades, reporting, quality initiatives, on and on and on. She helps practices achieve various quality statuses, and she has worked with various specialties. She has a wealth of knowledge and experience, so you can be sure that you guys are in good hands today. Christina resides in Michigan, and she enjoys going to concerts, exploring newly renovated downtown Detroit, and spending time with her family, friends, and of course, her retired greyhound, Daisy, as you see in the picture. She is certified MIPS professional, CMQP, CMIAP, CMCP, CMAP, and CHLP. And so let me hand it over to Christina so she can get moving. Thank you, Christina.
Thank you, Holly, for that prologue there. Just want to get started by going through our agenda on items we'll be covering today. Thanks everybody for joining. What I'd like to start with is what we're going to be able to take advantage of currently now related to MIPS. We'll go through some audit binder preparation for the different categories, PI quality, improvement activities, and cost. And then at the end, we'll go over some of the 2021 proposed rule highlights, just so that we can start to prepare a little bit as the year is coming to an end, prepare for next year. Additional resources, and obviously, we'll thank you at the end. Next slide, please. So let's go into what's available now. Next slide. So the first thing you can do right now to take advantage of is reviewing your performance year 2019 feedback. So it's available now. You'll log into your HARP account, view the information that's available to you, including your final score and your payment adjustment. And then if you have kind of questions or you feel you need to have a review with CMS on that specific feedback, now's the time for you to take advantage of that and request a targeted review. If you do request a targeted review, you'll want to make sure that you have some information available and reasons why you feel maybe a payment adjustment or your final score needs to be altered in any way. And I've included some of the links to the additional facts on what to have available in your targeted review request, and also how to log into your HARP account, create a HARP account if you currently don't have one, as well. But it's definitely a great time for you to make sure that what CMS has provided you in regards to your 2019 submission is reviewed, and you guys understand what you're getting and why. So they do offer some information in there for you. Definitely want to log in and take a look at that. Next slide. There's also some exception applications that are available for those of you who may have, some extreme and uncontrollable circumstances, or a hardship exception for the promoting interoperability category. So let's start with the extreme and uncontrollable circumstances. So this application can be used for, as CMS notes, public health emergency, uncontrollable circumstances such as COVID-19. So any kind of circumstance that's outside of your control. Maybe some of you have had some weather emergencies or crises in your communities. So this extreme and uncontrollable circumstances exception application allows you to request re-weighting for any or all of the performance categories if you've encountered this. So definitely if you're a small practice, perhaps you've been unable to collect information related to a specific category due to COVID. Perhaps you've been closed down for a period of time. Maybe you've lost staffing or streamlined your staffing during the time, since a lot of practices were only doing telehealth visits and things like that. You definitely want to take a look at that application and submit if it's available to you. And if you've been impacted, you definitely want to submit that. You have until December to submit that. However, the earlier the better, so you kind of know if you've been approved or not, and if you need to submit data based on that. So what this does is it will either reweight categories. Perhaps you are going to go for just one or two categories that you've been unable to collect information on, perhaps quality, or you're promoting interoperability. Maybe you were kind of engaged with some of the health information exchange functionality or something like that, but due to COVID, you've been unable to kind of finish that, so you're not going to have 3 months worth of data. Examples like that are reasons why you would want to kind of submit this application and ask for that reweighting in different to different categories. The next application is the Interoperability performance category hardship application. So this one specifically allows you to request re-rating for that promoting interoperability performance category. And what this does is it again would re-weight. You wouldn't have to submit data for the PI category, and your information or your re-weighting would be moved towards your quality and improvement activity categories specifically. So definitely those are some items that you can take advantage of right now, especially if you've been unable to collect data, if you're a small practice. There are many different reasons that you can fill that out. So definitely something to take advantage of. Next slide. Also, if you have been able to collect data, CMS did release a new improvement activity related to COVID-19. This is in regards to any kind of patient data that you are reporting through a clinical data registry, perhaps, if you're participating in any kind of clinical trials. And again, I've included some information in regards to that specific improvement activity to allow you guys to review that and see if it's applicable to you in your practice. Next slide. Due to the pandemic, just so everyone knows, in case you are able to take advantage of the complex patient bonus, they have upped the points from 5 to 10 points this year because of the pandemic. So these bonus points are added to your MIPS final score. And again, I have included a fact sheet on the complex patient bonus so that you're able to kind of review that information and see if that's also something that you would be able to take advantage of during this time and get prepped for during this time leading up to our attestation. So next slide. So those are different things that you can take advantage of now and get your kind of self-engaged with and get things in line so that you're ready to put that information into your audit binder. So our audit binder preparation definitely would want to include any kind of information related to those first slides we went through on what you can take advantage of, any kind of approval on any of those specific applications that you've entered, that complex bonus. You're definitely going to have information in your audit binder for that. But let's go through kind of some of the information that we definitely want to start either gathering, if you haven't already, into our audit binder so that we are prepared and have the information that we need in case we ever do get audited. And this should actually, be done every year. So your audit binder, you should have an audit binder, for every year. Keep that either in an electronic folder, or for those that, like paper, you can print things out and put it in a paper binder, but I prefer electronic, and that's just my choice. Next slide, please. So some general kind of suggested documentation related to your audit binder is definitely you're going to want to go and get that ONC certification ID for your software application that you're using. You want to make sure it's 2015 or above. Provided in a different slide is a link so that you're able to gather that documentation and get that into your audit binder. You want your install dates for your EHR application. You might have a contract or specifics related to those install dates. You might have gone through an upgrade where you have documentation or screenshots of, the upgrade to your 2015 certified version. Definitely want some information on that if it's available. Any kind of staff credentials. you want to have those on hand, your participating providers, staff credentials such as your nursing staff, licenses, information related to that, just to make sure that you have that information available in case CMS asks any questions, so that you have it all in one place. If you have providers that aren't participating in the program but are a part of your group, you would want some documentation, if applicable, for those providers. Any kind of business associate agreements for MIPS reporting with your providers. Perhaps you have a agreement that you have your providers sign. You definitely want to have that in there so that they understand that you're reporting as MIPS, perhaps as a group or individual. Have that laid out. Just make sure you have that information available. You also want to have your checklist for all the items that you're including in your audit binder, just to make sure it makes it kind of like a easier way for you to make sure you've captured everything related to the different categories. Next slide. On the next slide, we'll have a sample of like an audit binder checklist that I put together for my clients. Obviously, there's more to it than these two samples, but these are kind of a checklist that you would go through, have it laid out based on different categories and your general information related to MIPS overall. Next slide, please. Additional information, as I stated before, is your exception application. If you have that information available, if you are a special, special status, if you have that specification in regards to MIPS, you want to have that information available. Any kind of validation criteria from CMS that you've used, so your benchmarks, perhaps any kind of improvement activity documentation that CMS has given, specifics related to that reporting year, definitely want to have that available to you in your audit binder. Again, I noted before, upgrade patches, any kind of regulatory reasons that you've upgraded or specifics related to an upgrade that your EHR vendor has had you do, any kind of specifics that they've provided, screen prints, showing that that information is installed and completed is definitely helpful to have. And then any kind of workflow documentation related to the specific measures and objectives for the MIPS program that your EHR vendor has provided to you. You'll want to have those available so that, if there is questions on how you capture information related to a specific measure or objective, you understand and have that information available both from your EHR vendor and from CMS, so that you can show any kind of auditor or show proof of that information being captured accordingly. Next slide, please. So let's move on to promoting interoperability. So again, suggestive documentation for that in regards to your registries. Definitely want to have documentation related to active engagement, either registration details, perhaps a letter showing that you're actively engaged, any kind of screen prints perhaps that you might have showing information pulling through successfully, testing, validation documentation, exclusions documentation if this registry objective is not applicable to your practice, the reasons why, any kind of documentations you might have. And then also you want to have those measure specifications both from your EHR vendor and also from CMS. Next slide. CMS also has you submit attestation statements. So you have the ONC direct review, your surveillance, your prevention of information blocking statements. So if you have policy and procedures related to information blocking specifically, you want to make sure you have a copy of that in your audit binder. Any kind of implementation of any new application functionality or software or anything regarding anything that you've set up within the reporting year, you want to make sure you have that in there. Reports that you've used throughout the year for validation, a policy and procedure based on your patient portal, you want to make sure that's in there. Patient information that you've provided to patients in regards to the portal, any kind of policy and procedure on your health information exchange, patient consent related to your health information exchange. If you're exchanging information electronically, making sure that you have that in there, have a sample of your policy or your patient consent on that that a patient might sign for. Any kind of policy or procedure related to record requests, showing that you're not preventing any kind of blocking of information. Patient consent and a statement sample for those record requests as well. Next slide, please. Your security risk analysis is another item that you definitely want to have updated or reviewed each year, and a copy of that in your audit binder from year to year. Any new changes that are completed within the reporting year, you want to make sure your security risk report is updated, noting any of those changes, any kind of analysis that you've had showing, a full reporting period for dates of specific items that need to be shown for the entire reporting period, documentation of your security updates, any kind of deficiencies, and what you are working towards in completing any of those deficiencies to make sure that those are now updated and in effect. Any kind of potential risks of PHI, and a plan for correcting and mitigating any of those deficiencies, including steps to implement your plan. Included is some additional information regarding the security rule, guidance on your security risk analysis, and some free tools and resources related to that analysis. Next slide, please. So within the promoting interoperability category, there's different objectives, and one of them is e-prescribing. So for your audit binder, you'll want to make sure in regards to e-prescribing, you have your enrollment information in there for your providers, any kind of eligibility check or documentations related to like system configuration preferences, screen prints related to any kind of eligibility checks, formulary. You'll want to make sure that you have screen prints of showing that's been installed and that you're using that functionality. You'll want to make sure you have a sample of your patients that you've provided eligibility checking on, perhaps screen prints as well related to that patient or those group of patients, a sample of those patients, obviously de-identified if you're keeping it in your audit binder. If you're claiming an exclusion for this e-prescribing measure, supporting documentation such as reports that you've used for validation, or perhaps other documentation just noting that your providers aren't using this e-prescribing, they're claiming the exclusion because they're not prescribing more than 100 prescriptions within the reporting period. And then all your reports that you've used throughout the year for your validation, and then your final report that you've used for submission. Next slide, please. If you are going for the PDMP bonus, so the Prescription Drug Monitoring Program bonus, 10 points is the new proposed point system for that bonus. So you'll want to make sure you have documentation regarding the installation and registration for that PDMP. Any kind of state specifics that are in regards to the PDMP, any kind of documentation your state might have on that, you'll want to make sure that's available in your audit binder so that if perhaps CMS questions anything on what you're doing or what's available, you have that information. Again, a sample of your population showing that you completed the PDMP. Screen prints of any kind of additional setup within your EHR. You'll want to make sure that that information is available showing the setup. Make sure in your screen prints for all of these different categories that you include dates so that they can see that the dates are within the reporting period. Again, reports used for validation and submission, so reports you've used throughout the year. Any kind of workflow that you might have for your staff, or just you know, as a document showing how you're getting the query, and any kind of policy and procedure you might have related to the PDMP query if you have that in your practice and if it's applicable. Next slide. So for the patient electronic access objective, definitely wanting to show that you have the portal enabled, so you can make sure you have screen prints of that showing it's enabled, showing the portal functionality, all the different information that's available to your patients, all the different kind of functions such as secure messaging, any kind of patient-initiated enrollment perhaps, any kind of functionality that's in there that you're allowing patients to do, downloading of their health record. So you'll definitely want to make sure you have that information available, screen print showing that. If you have additional setup that you have to do within your application, you'll want to make sure that's available as well. CMS notes in regards to the health record information, I've listed here and provided all the different information that CMS notes the information must include. So you can kind of review that, make sure you kind of have that information either in a document format or screenshots showing that this is available within the portal for them. Next slide, please. Any kind of end user workflows related to the patient access measure. Again, a sample of the population showing that you've provided information within the 4 business days after a provider's received the information. So any kind of lab results possibly that you've sent over, maybe some orders that you've had completed. Any sample of that population, just showing that you've provided that information within that 4 business day period. The 4 business days comes from CMS. That's specific to their guidelines, just so you're aware. If you have a portal help desk at your facility, you want to make sure you kind of have that information showing what you're providing to your patients and how they get assistance for any kind of troubleshooting or any kind of issues that they're having. Also, any kind of other information that you provide to your patients, perhaps instructions for their account to create an account. Maybe you provide a user guide, maybe you have flyers around or information that you give to your patients. And then you also want to make sure that you have a sample group of a population that is using the portal. So I would have samples of like your secure messaging functionality, where maybe a patient sent a message to you and you're organization has replied, as an example. So you want to have a sample that, as well as make sure you include sampling of patients that have completed that health record download that's available within your portal. Any kind of API information, you want to have documentation on that, showing that it's enabled, showing it's installed. Again, if you have patient-initiated enrollment functionality, make sure you get screenshots and documentation showing that that's enabled, maybe a sampling of patients that have enrolled using that functionality. Web page, you definitely want to have information regarding your web page, showing your link that you have available for the patients to access. It's a way that obviously they have continued access. Any kind of supporting documentation you might have if you're claiming an exclusion for the patient access objective. And again, you always want to have those reports that you're using throughout the year for your validation, and then your final report that you've used for your submission regarding the patient access. Next slide, please. So next objective is supporting electronic referral loops by sending health information. So for this category in your audit binder, you want to make sure you have a sample of a summary of care that was created using your health record. Again, sample population, where a summary of care was sent electronically. Any kind of documentation, screen prints showing your system configuration or setup within the application. Any kind of documentation, again, or screen print showing the active messaging or communication services that you're providing. Clinical workflows that you might have on hand for your protected health information and electronic summary of care. Again, those reports that you're using for validation and submission, and then supporting documentation if you are claiming an exclusion for this measure as well. Next slide, please. You also have the support electronic referral loops by receiving and incorporating health information. Again, want to make sure you have those sample populations where you received information electronically. If you've had a transition of care within the population, you want to have a sample of those patients. Any kind of reconciliation that was completed on those transition of care, including your problems, diagnoses, medications, allergy listing, you definitely want to make sure you have screenshots or samples of the population so that if you were to be audited, you have those patient identifying numbers available so that you can have that list in front of you and show an auditor or take screenshots when an auditor asks based on those specific samples of the population that you might have. It's just an easy way to have those patient identifiers in number formats so that you can kind of have that list and go to a patient chart if needed. Any kind of applicable setup configuration regarding electronic referral loops. If you have an external HIE, making sure you have that information and documentation available. Active messaging, again, you want to make sure you have that screen prints and documentation. Again, as with all of these objectives, if you're claiming an exclusion, you want to make sure you have any specific supporting documentation for that. And then, of course, all the reports that you're using for your validation and your submission. Next slide, please. So we'll move on now from PI to our quality category. Next slide. Again, the information I'm providing today is suggested documentation. I feel it's really necessary to be prepared for an audit, even if you are doing quite well. You never know when CMS may come knocking, so I feel it's better to be prepared for all of this. So suggestions in regards to our quality measures are a list of the measures that you are working on throughout the year, making sure that you have the high priority and outcome listed within that list that you're working on. Any kind of workflow documentation and specific information from your EHR vendor, along with the CMS documentation related to those quality measure selections that you've chose. Any kind of specifications related to either the ECQMs or the MIPs CQMs. Benchmarks that you're using for the reporting year. Benchmarks note obviously how many points are applicable to that specific quality measure. And then your reports that you're using, again, for your validation and submission that you've used throughout the year. So you should have reports kind of that you are using throughout the year for each of these different quality measures and each of these different objective categories to show that you are actually reviewing the information. If perhaps something isn't pulling through in the way that you think it should be pulling through, information that you've been working with your EHR vendor, maybe communications that you've sent, maybe meetings that you've joined, just kind of a list of things that you've done for this validation process along with the report. Next slide, please. Next is our improvement activities. And next slide, we'll go through the suggested documentation for that. So again, you'll want your list of your measures that you've selected, any kind of policies and procedures that you may have in place related to your specific improvement activity, if applicable. So maybe one of the items could be I know a lot of organizations choose the provide 24/7 access to patient's health record as one of their improvement activities. So, you know, any kind of policy procedure related to specifics on how a provider is accessing a patient chart if they're not on site, how you have that specific setup available to providers that may be doing rounds in the hospitals, or if they're on call, how they're accessing that patient information, how they're documenting possibly a patient call or a provider call related to any kind of patient. So you'll definitely want to have a policy procedure in place, screen prints showing that functionality for any of those selected measures. If you have selected improvement activity measures and you have meeting minutes related to implementation or discussions surrounding any of those improvement activities, you'll want to include those meeting minutes so that you know, CMS can see that you're actively engaged with your organization team members, so that obviously they know what specific improvement activities you're working on. If there's any kind of changes to their workflows, you'll want to have that information available, information showing that you've dispersed these workflows as well, if that's applicable. Reports, if you have reports that you're using throughout the year related to specific measures that you've selected, you'll want those available. Any kind of reports in regards to your population or impaneled patient lists, if you've selected any of those, and then any kind of suggested documentation related to the specific improvement activity that CMS provides. You'll want that in your audit binder as well. Next slide. Additionally, screen prints, any kind of tools or documentation on tools that you're using for a specific activity that you've selected, self-management, if that's applicable, if you've chosen any of those self-management measures, you'll want screen prints and documentations that patients are engaged. Any kind of leadership communications, again, meeting minutes with your core team, perhaps related to any of the improvement activities and what you guys are doing to facilitate those. End user communications, and a list of community resources that you guys might be using in relation to any of those measures you've selected. Next slide. Cost category, next slide. Cost category is pretty much all I have in this objective is the information that CMS provides. Obviously, this one's kind of out of our control, but you know, if you have information or if you're going through these cost objectives and you have more information to provide in your audit binder related to, you know, any of the measures or any of the listing, feel free to add that in. But I do have the information that CMS provides and links to provide you today for that. Next slide. So it's been kind of a whirlwind, sorry, but we have went through what you can do now. We went through how to get your audit binder prepared, and that does take a little bit of time. So if you haven't started on that, I suggest that you start putting that together. Let's go into what you can prepare for 2021. So CMS released their proposed rule, and I've just kind of gathered together some highlights related to that. So MIPS value pathway, they noted that they won't be moving forward with the MIPS value pathway implementation in 2021, but they said that they may revisit that until in the 2022 performance year, or perhaps they may move forward with that later. And just so everybody knows, MIPS value pathways is just a set of measures and activities that can be used to meet the MIPS reporting requirements. So it's specific measures and activities that CMS gives that some organizations may choose to move forward with with the ability to meet those reporting requirements laid out by CMS. They have proposed some small revisions to that MIPS value pathway and proposed new development criteria. More to come on that later. Figure we don't need to worry about it this year, and we'll look at it more again in 2021. Next slide, please. Proposed APP reporting option. This is available for those of you that are participating in a MIPS APM. This would include 6 measures, and they're all focused on population health. And these specific quality measures that are reported are automatically used for scoring under the Share Savings program as well. So you're kind of fulfilling two needs in one with this proposed APP reporting. Next slide. They proposed a new performance threshold. So performance threshold to be at 50 points. It was supposed to go up to 60 points, but they're now, due to COVID-19, leaving it at 50 points or proposing to leave it at 50 points. So that's good news. Next slide. Category weights. So they proposed that the following category weights be in line for 2021. So quality would be weighted at 40. It was supposed to be 45, so that's a 5% decrease from this year. Cost will be weighted at 20. You can see that that's a 5% increase from the 15 in 2020. The promoting interoperability, there's no change in that. They're proposing 25%. Improvement activities, also no change, still weighing that at 15%. Next slide. Just a little graph showing 2020 compared to 2021. Next slide. Quality category, few proposed changes there. They're noting that in place of historical benchmarks, they're going to use performance period benchmarks. So that's a proposed item for 2021. They're updating the scoring for topped-out measures. So they're applying a cap of 7 points for 2021 and beyond. So that's proposed as well. They're removing 14 quality measures and proposing a total of 206. 2 administrative claims measures are going to be new. More information to come on those. They are proposing to end the CMS web interface as a reporting option. So that's new. Next slide. Cost and IA changes, updating measure specifications to include telehealth services is the biggest thing for cost. And improvement activities, they're just establishing new policies in relations to the annual call for activities due to COVID-19. Next slide. For PI category, they're proposing that they're keeping the PDMP program, and they're also proposing to make it worth 10 bonus points. They changed the name, or they're proposing to change the name of support electronic referral loops by receiving and incorporating health by replacing incorporating with reconciling. So it'd be support electronic referral loops by receiving and reconciling health information. Not a huge change there. And they are adding an optional health information exchange bi-directional measure. Again, more to come on that once the final rule comes out. Next slide. So in regards to 2021, what can I lose? I can lose a -9 for not meeting the minimum score of 50. And I can gain up to a +9 for as a positive adjustment. So we're at 9, either up to 9% negative or up to 9% positive in 2021. Next slide. Exceptional performance bonus is again capped at 85%, so that's no change from 2020. So 85 points allows you to get the exceptional performance bonus. 85 points overall for MIPs. Next slide. And just a few other informational links for you guys in case you have questions. Just offering those up as in regards to the proposed rule, fact sheets, and any kind of QPP resources, just providing the links for additional information. Next slide. Again, if you kind of need some additional help from the quality payment program, I've provided the phone number, their email. Again, in the beginning slide, I noted that you wanted to get your certification ID, so the website to obtain that's been included, and then some additional timelines and deadlines that the QPP notes. I've given you access to those as well in case you have additional questions. Next slide. All right, I will turn it over to Holly.
Okay, I don't have any questions in the question box. We do have a few minutes in case anybody wants to send some over. If questions come to you later on when you're either reviewing the video or just in general, feel free to reach back out to us. We can answer those at that time. If you don't know who your salesperson is, send that to info@emedapps.com and we will get that to the correct person to follow up with you. And of course, if you guys are not having questions because you're overwhelmed and you completely need help, just contact your salesperson. Christina has a great program and a great team underneath her to help jump in and take care of anything that you guys can't in these areas. So we're happy to talk to you about what we can offer there as well. But again, thank you for attending today. Any questions? I'm still not getting any in the box, so feel free to send those later on and look for the follow-up email with the recording. And we thank everybody for your time today, and hopefully it was helpful. So we'll give you a couple minutes back in your day.